All right, everybody, welcome again to the Friendly Neighborhood Oncologist. And I'm a board certified medical oncologist. I practice in one of the large metropolitan areas here in the United States, not far from one of the top medical schools and one of the top cancer centers where I did parts of my medical training. And what I do on a daily basis, I try to help cancer patients kick cancer in the you know what. So there's a lot of information and misinformation online for patients, and I do try to help them with prevention of recurrence, quality of life, length of life. So this channel is really about connecting people to free medical resources that are considered the gold standard of care here in the United States. So thank you to everybody who's tuning in, who wants to immerse in the Oncoverse. If you're not part of that community yet, please hit the subscribe button. It's free. And please smash that like button. As the millennials say, just destroy it. We've got to get the Friendly Medical Oncologist a few likes and subscriptions. So as a caveat, although I'm a board certified medical oncologist, I'm not your physician. Please seek your own medical care. Nothing that I say should be construed as a medical diagnosis or as a recommendation for staging or treatment. All right, well, let's get started. So we've touched on the National Comprehensive Cancer Network guidelines, and we're talking about non-small cell lung cancer. And as people know, this is a committee on non-small cell lung cancer that includes people from some of the more prestigious academic cancer centers here in the country. And this is a free resource. You can sign up at nccn.org, which is on the link for my YouTube site. And unfortunately, in staging by the American Joint Commission on Cancer, we unfortunately do have patients with distant metastatic disease with non-small cell lung cancer. And recent statistics, more than 50% of patients presented with advanced disease. There are some indications for annual screening in lung cancer, which we can discuss at a different time. So unfortunately, we're talking about patients who fit over here with advanced disease that is not resectable. So we're going to go back up to the beginning of the guidelines, and these guidelines are things that I often print out for my patients, review with them at the time that we're meeting in our clinic. So these are patients who unfortunately have stage 4 disease with distant metastatic disease. We, of course, make sure they have brain MRI, PET CT. We work closely with the multidisciplinary team, pathology, to confirm the exact histology, which is, in this case, non-small cell lung cancer, further divided into squamous cell type and non-squamous cell type, such as adenocarcinoma, large cell, or otherwise. So in our patients who have multiple metastases, who have reasonable performance status for treatment, what we're of course still referring them for smoking cessation and integrating palliative care. And I touched on the type of histologies that we might encounter. I think it's important to remember that molecular testing is now a definitive standard of care. So specifically, I use next generation genomic sequencing, and I'm able to readily get information about the malignancy. Does a patient have an EGFR mutation, such as exon 19 deletion or exon 21 substitution? I had one of the first patients in the greater Houston area with an ALK1 mutation before there was an FDA-approved inhibitor. Now we have many inhibitors for ALK1, KRAS mutations, ROS1, patients with BRAF V600E mutation, for example. I have a patient who's doing quite well on inhibition of that pathway. Of course, we're always looking for NTRK, MET, and RET. And again, broad molecular profiling is considered the standard of care on our guidelines. PD-L1 testing is also considered a standard of care. In the advanced setting, it's beyond the scope of this to talk about immunotherapy with pembrolizumab versus chemotherapy alone in patients with greater than 50% PD-L1 positivity. That was studied by Dr. Reck and colleagues in the New England Journal of Medicine, published in 2016, and was referred to as the Keynote 24 trial. And of course, the control arm was a platinum doublet without pembrolizumab, because that wouldn't have been the standard of care at that time. So again, beyond the scope of this particular talk to talk about that in detail, but again, very important to remember that advanced molecular testing, PD-L1 testing, is considered standard of care, whether in squamous cell advanced non-small cell lung cancer or in the non-squamous cell types. So I will quickly go to negativity of those studies. So let me pop back. I'm going to pop back to patients who have advanced disease and who have multiple metastases and are appropriate for treatment. These patients would not necessarily have any of these markers testing as positive, and they would be appropriate for systemic treatment. So generally speaking, I'm not going to go into dual immunotherapy at this time. I won't get into the details of which platinum doublet for squamous cell and which platinum doublet for non-squamous cell. So specifically, Keynote 407 for squamous cell, published by Dr. Pazares in the New England in 2018, or for the non-squamous non-small cell, Keynote 189, published by Dr. Gandhi and colleagues in the New England Journal, also in roughly 2018. I think that'll be out of the scope of this particular discussion. So I'm going to end at this point and just kind of emphasize that once again, I am not a medical representative, legal representative, or in any way representing the National Comprehensive Cancer Network group. They're a free resource available for patients. And I, in this capacity as well, presenting some of this for educational purposes, I'm not speaking on behalf for any of the manufacturers of any of these agents. And again, thanks everybody for tuning in to the Friendly Neighborhood Oncologist. And thank you for immersing in the Oncoverse. If you're not part of that community, again, please consider subscribing and smashing that like button. Thanks so much, and I'll tune out.